Good afternoon, everyone. Thank you for joining us. The QTECH monthly meeting will be starting shortly. Good afternoon, everyone. Thank you for joining us. This is our monthly QTECH meeting for October. We will be starting shortly. Just give us a few more minutes and let some other folks hop on. If you have a chance, please join us for our fun word activity. From your mobile phone, text 22333 and enter COVID-19 Heroes. That's COVID-19 Heroes, COVID 19 Heroes, and answer the following question. With the holiday season approaching, what are you looking forward to most? With the holiday season approaching, what are you looking forward to most? We see pumpkin everything, shopping for gifts, just a fun activity to get us started. If you haven't already done so, Alliance Chicago and Health Choice Network are joining together for our virtual educational conference. You can scan the QR code on the screen there, and you can register if you haven't already done so. It's happening November 4th through the 12th. We hope you can join us. All right, it's about 3:02. I think it's about time we get started. Hello, everyone, and welcome to our October meeting for QTECH. My name is Stephanie Martinez, and thank you for taking the time out of your busy day to join us. Before we get started, I wanted to start with a fun activity. So take out your phones and then dial 22333, and then in the text, in the message box center of your phone, put in COVID-19 heroes. That's COVID 19 heroes. The question for today is, with the holiday season approaching, what are you looking forward to most? And the slide doesn't seem to be moving, so let's see what's going on. It was just working a second ago. All right, well, we'll move on. So for today's agenda, just bear with me, I have some technical difficulties. Okay, thank you. I'm sorry for that. I did have some technical difficulties getting back onto the page, but for today's agenda, we've got a very nice agenda. We welcoming everybody. We do have a nice health center spotlight today with True Health. We've got our SMBP updates. That is a hot topic, and I think a lot of you folks will want to hear about that. We do have our CISO team sharing our National Cybersecurity Awareness Month updates, and then we'll be presenting on some diabetes focus. We do have some QTECH grant updates, and then we will have some open discussion and wrap up. Before we get started with our Health Center Spotlight today, I thought we would start with a poll question, and I'm going to launch it now. This does work directly on the screen. Okay, so which services is your health center currently providing via drive-through or drive-up? This will help our Health Center Spotlight speaker actually get an idea of what everyone is up to currently. So some of the options are COVID testing, HbA1c testing, HIV testing, immunizations, none, but we are interested in starting. This is a multiple choice response. You can choose more than one. So you can go ahead and pick more than one response if your health center is actually offering multiple health center drive-through. All right, so it looks like we're at about 51% voted. I'm going to give that a few more seconds. Okay, let's close out the poll and see what we got. All right, so it looks like most folks are offering COVID testing services. 88%, 25% are offering HbA1c testing, 13% are now offering HIV testing as a drive-through service, and we've got about 13% who are interested in starting but have not yet started. Let me hide that. Okay, so we encourage you all to ask questions throughout the presentation. You can use the actual chat function on the GoToWebinar, or at the end, we can also stop for questions and we will unmute you. So raise your hand and we can unmute you and you can ask questions. So today we are going to hear from Narez Madhani. He's the Director of Quality and Care Coordination at True Health. True Health is based out of Sanford, the Orlando area in Florida. They provide services in primary, adult, and pediatric care, OB, GYN, podiatry, dental health, behavioral health, and a wide range of other services. Narez will provide you an overview on True Health, on how True Health is conducting drive-through vaccines, and demonstrate how during the pandemic, health centers have continuously evolved how they utilize their services, care teams, and other resources to provide quality and accessible care to the community. Narez, are you with us? I'm going to hand it over to you now.
I am. Thank you, Stephanie, and good afternoon, everybody. Stephanie, I don't see the slides on my screen.
Okay, click on the Go to Webinar, and you should be able to see on the drop down. Um, it doesn't pop up the screen for you? No?
I didn't. That's okay, as long as I have the slides up. So
Okay.
I'm Nurse McHaney. I'm with True Health. Thank you for having me, everybody, and we'll just go ahead and get started. So, I noticed on the polls, I think it was 88% of you guys have been doing drive-up testing in some form or another. And by now, many of us, especially if we've been doing it, are kind of experts and we've got our way down. But we've also realized that immunizations across the board are down. Well, encounters across the board are down. Immunizations, well visits, especially for the kids, are down. We're seeing cancer screenings. All of us are seeing our HEDIS rates drop, and all of our insurance company partners are like, "Hey, what are we doing? How can we support you? Are you still calling people? There they are. There's the slides. Are you still able to get in touch with people?" And so this is something that we had kicked around for a while, and we partnered with Simply on this, and they were kind enough to give us some funds to help us with some expenses. But you don't necessarily need a partner. And so our goal was, and many of you will recognize some of this language, it's a AAA C10 step. We are going to use this as a write-up this year. So our purpose was to hold a drive-through vaccine event in order to boost immunization rates amongst our school age and adolescent population. And our goal was 80 nurse immunization appointments. And then if needed, we could convert those appointments, because we had openings on the schedule, to provider appointments. So let's say, for example, there was a child, they were sick, had a fever, we couldn't give them the vaccine even though they were scheduled, but we could just see them as a walk-in, let the provider determine, could we give them the vaccine, could we not, and go from there. If we get the slide, there we go, I think. Slides are changing, not changing. That's all
I
right.
apologize, Nareza. I'm not really sure what's happening. The slide keeps saying failed to open, which is
Yeah.
very odd. And I apologize to everyone. I'm not sure what happened there, but can you see the slide now?
Yeah, so you can stay on this slide. I'm just going to go, there's
Okay.
a couple of slides before that, but just stay here. That's fine. So for us, we had several departments that were involved, both in advance and on the day of. So nursing, medical, operations, quality, which is me, facilities, and IT. One to 4 weeks before the event, we started scheduling appointments. So you got to open up the schedule. You have to make sure that the call center is aware, PSRs, care coordination team, PSRs is patient service representatives, all the clinical and the site manager, so they can pass it on to their staff that we are holding a drive-through vaccine day, and then letting people know and starting to fill the schedule. 1 week before the event, I worked with the nursing staff with the director of nursing, finalize the traffic flow, the process, and the layout, share the map with all departments, enter a ticket in with facilities. We work on a ticket system with various departments, and so that's what works with us. And so what supplies were needed for the event? So tents, tables, chairs, fans or misters, extension cords, biohazard cans, sharp containers, and then things that you might think of. Operationally, the site managers and the PSRs, as they scheduled appointments, and the care coordination team, we use DocuSign to send out our demographic packets in advance. And so they were sending the packets in advance to all the new patients or patients that were requiring an update. As those were coming back in, confirming receipts, making sure that photo IDs and insurance cards were uploaded and legible. If documents were incomplete, making sure that patient was contacted, making sure that everything was updated in Centricity. Insurance verification started a week out, and then changing the PCP. And you guys know how much of a pain this is, because you got to get the patient to do it. It's not just us simply calling. And so not only making sure that the PCP was changed, but following up with them and making sure that it stayed changed. And then entering an IT ticket, a ticket with IT, to verify that DocuSign is working on all the portable tablets that we used out at the site on the day. And so that brings us to this slide, 24 to 48 hours in advance. And you guys will all get the slides, or you can download them over on the side of the screen, so that you have the information. And I know there's a lot of words on the slides, but I wanted to make sure that I gave you guys all the information that I had. So on the day of operations, I'm sorry, 24 hours in advance. Again, verify insurance for those that were not. And we know Medicaid, they change constantly, so you have to verify again. Contact patients if PCP still haven't been changed. Confirm registration information. Contact the patient for anything missing. Print the schedules. Make notes for anyone that has anything missing, making sure that the PSRs that are working that day collect it. And then nursing, chart checks to confirm the vaccines that are needed were in the chart, checking Florida shots, looking at any other gaps in care, flu vaccine, for example, if they're age eligible, contacting patients as needed, converting patients to the regular schedule if needed, pulling Florida shots records, pre-printing VIS sheets, gathering patient information. We handed out something from Merck on HPV, but there's lots of great information out there that you can hand out. Arranging all the paperwork together so that everything was in order of the appointments, assuming everybody comes in on time, right? And then, once the PSRs came up, they would grab the packets, hand it off to nursing, and everything kind of worked. And then preparing the supplies. You got to make sure you have enough vaccines because this may be a little bit busier or at a site that may not have as many vaccines as you might need for that day and for regular business. And so if you want to go to the next slide, on the day of the event, and I split this up into 2 slides because there's a lot of information. So facilities got there, and I didn't include this just because it's basic stuff. Facilities got there at the time of their ticket, set everything up. Nursing and the directors got there, made sure it was set up properly, tested everything was good to go. Operationally, the site manager and the lead PSRs got a list of the schedule to the people directing traffic and the person checking in patients. Now for us, on this day, it was our members of our nursing department that were out there doing traffic. It may be facilities for you. It may be another director. Definitely have them wear a vest and be safe. They have a clipboard, they're directing traffic, and you'll see some pictures in a minute. Mark off patients as they arrive. At the end of the event, compare schedules, make sure everything matches up in the computer. And then as they pulled into the into the immunization area, place a green registration paper on the windshield of cars that did not require additional assistance after the PSR worked them up and checked them in. So this indicated that they were ready for the nursing department to come over and start doing their part. If they required assistance, further assistance from a PSR, put a yellow piece of paper indicating that they needed more assistance from PSRs and somebody needed to get with them. And then again, using DocuSign to register patients who did not complete their demographic packet prior to the event. We go to the next slide, and now we have nursing. And here's where it gets long and lots of words on the page. But basically, so nursing goes up, they've got the green, they're ready to go. They go over and talk to mom and dad and say, mom or dad or the guardian, making sure that they knew what the process was. 2 MAs working in tandem, no matter how many patients were in the car. It was teams of 2 MAs. At the information table, 1 MA got the paperwork ready. Florida shots was confirmed because it's already printed off. VIS and the packets were given to the patient, the parent, and the guardian. Questions or concerns were answered and addressed. Temperature, COVID check, all of that happened. Once the parent and guardian has agreed with the plan, then the MAs went inside the facility. Patient is still parked in their car. And it'll make more sense when I show you the pictures. Our staff goes inside the facility, has the provider drop the orders in. 1 MA does all that with the provider. The second MA pulls the appropriate vaccine in a cooler. The team walks back out. They match up, make sure that everything that's needed is what they have. Then they match the orders with the vaccines, return to the vehicle, the 6 rights of medication administration, and then administer the appropriate vaccines. Obviously with PPE as needed, sharp disposal as appropriate, extra supplies as needed, whether patient started bleeding or anything like that. Then the parent was redirected to the holding station where we put a timer on the hood of their car for 15 minutes. And then after the 15 minutes, no adverse reaction, they were released. And so if you go to the next slide, you can see we held this at our Lake Underhill location. Lake Underhill and Cimarron Boulevard are very, very busy roads. Right behind Lake Underhill on the black section of your screen is the 408, which is an 8-lane highway both ways. And so you can see there's multiple entrances to the parking lot of our facility, and you can see in red the main entrance. The express entrance is over to the side, and that's the side that we held a vaccine clinic. And just to be fun, at the same time, because it's the morning and we do COVID walk-up tests from 8 a.m. until 9 a.m. every day at all of our sites, in the purple, now I see it's a little bit hard to read, but down there under those green boxes, you see COVID testing. So that was happening at the same time as we're directing traffic. So definitely make sure you want to be safe and you have a good traffic flow organized. So you and all your team members know exactly what's going on, and all team members can direct patients as appropriate where they need to go. If you go to the next slide, you can see what the setup looks like with no cars. So this is right outside that express area. You see those two tents, and in the green writing, that's the immunization station, and then over on the left-hand side, the holding stations. Now, we blocked off 6 parking spaces in the immunization station, 6 parking spots in the holding station, and we blocked off an extra 6 parking spots just to be sure, because this was our first one. So we had a lot of space, and this is actually one of our busiest facilities with the smallest parking lot. And you can see the setup from another angle. If you go to the next slide, you can see the information table, and then next to it is a station where we had Simply bags that we were handing out. And this is a close-up. This is a shot of the immunization station. And you can see one of our nursing staff, Mr. William, out there in his vest. And then there's a door that goes into the clinic right there behind the tent, and that's what the medical staff were using. So what did the traffic flow look like if you go to the next slide? So this is Joseph on the left slide directing a car, and they're going to turn right to where that cone is into the immunization station. Mr. Will sees that car come up. Once they've gotten the name, they then check it off on his clipboard, and he goes over and he starts the paperwork process and hands it off to the PSR. If you go to the next slide, you see the PSR working up a patient, talking to the parent. It's not the same car. Working with the patients, making sure that they have all the information they need, talking to mom or dad or the guardian. And then they did the nursing handoff. You see the same PSR, and you see one of the nurses both talking to the patient, or the parent, I'm sorry, making sure that they understand everything, they understand the process, and then they do a warm handoff. If you go to the next slide, here's your nursing tag team. So once again, verifying, here's the name on the schedule. Here are your 2 MAs on the outside, your PSR in the middle. And then your MAs are going to approach the vehicle, and they're going to start doing their confirmations, right? Having one of those little slide tables or portable tables is key, just so that you can have a place to set things down on, to write things on. It doesn't have to be a medical cart. It can be any kind of cart. Obviously, make sure you sanitize it and make sure you clean it as appropriate. So if you go to the next slide, they go inside, they verify with the patient, they go inside, they got the shots, they come back out. You can see now they're running their verifications, and then in the right hand, they're delivering the vaccine right inside the car. Okay? And then the parent is directed, if you go to the next slide, to the next area, to the holding station. And you can kind of see in the background there. So basically what we did was we had them pull into one parking spot, and then all they had to do, we hold traffic, and they reversed right into the next parking spot right behind them. And then this is actually 2 different cars. They just happen to be the same color. And there's cheap, I don't know, $5 or $10 digital timers that we got on Amazon. And then we rotated them out just because of the sun, and they're cheap. So they may break down in the sun. And that was it. The biggest concern for us, we call it drive-through vaccines, but you can't let people drive through because you have to hold them for 15 minutes just in case there's a reaction. But this worked out really, really well for us. And we have our next event on November 20th at our Hoffner, November 23rd, I'm sorry, at our Hoffner location. So we chose October 12th. Why? Columbus Day. Teachers are working, schools are closed. Parents already have to do something with their kids. So it's a great day to schedule a doctor's appointment. November 23rd, the first Monday of Thanksgiving break of that week. Again, parents already have to make other arrangements for their kids. Another great day to go ahead and schedule a doctor's appointment. So what does the data look like, right? How successful were we? So let's go to the next slide. So we had a goal of 80 patients. We ended up with 53, which we were happy about. 72% of them showed up, which is great. 38 patients, which is amazing. And then you can see all the different CPT codes of all the different vaccines that were given out. 8 HPVs, and I can't tell you if those are initiations or series completions because I don't have, CPS doesn't allow that level of detail, unfortunately. 32 flu vaccines, a couple of Tdavs, a couple of meningococcals, some, one MMR. So a total of 52 vaccines were given out on that day. That's it. I'm open for questions. What do you guys have?
Thank you. Actually, I think you did answer the first question. The first question was, when was the vaccine event held? And you did respond to that, like when was the best timing to do this? So other than that, I don't see any other questions in the chat. Diana, on your end, do you see any hands raised?
I don't, not at this time.
Okay, I don't see any hands raised.
All right. If you go to the next slide, my contact information is there. Again, you guys all have access to the slides and all the information. Call me, email me. I'm happy to give you direction, help, walk you through if you have specific questions about what we did or how we set something up. Happy to share with you whatever you need.
Great, thank you, Nerez. We appreciate you taking the time and providing your insight for the meeting today.
No worries. Thanks so much. Appreciate you having me.
I'm sorry, I do see a question now on the chat.
Sure, go ahead.
From Veronica Luna. Veronica Luna is asking, how did they pool their patient list for those that needed vaccines?
So you can, there's multiple ways, right? So you can run internal reports, depending on how robust your reporting system is or your EHR is. You have your insurance company gap in care reports. Usually, we work the wellness care, well child checks and adolescent well visit reports, because if they need a well child check or an adolescent visit, they probably need a vaccine. And so then we were able to either convert them to a physical or schedule them for at least the vaccine portion. We also looked at our back to school lists of those patients that may have gotten an initial vaccine at back to school back in July and August and may have needed a booster by now. Or if they missed their vaccines for whatever reason when they came in for their school physical and then just needed their immunizations. And then as people were scheduling appointments, if a well child check came in, but the patient was sick and the pediatrician said, can't give the vaccine today, Johnny's running a fever, you need to come back, we scheduled them on this day. So you have a variety of places to get the information, and then you have to make sure that you train all of your staff that may come into contact with patients about who is appropriate to schedule on this day. We didn't do anybody under the age of 5 or 6. Why? Because we didn't want to be holding screaming babies in a car in the heat outside. 5, 6 years old, yeah, they're going to may cry a little bit, but it's manageable. It's okay, whether it's leaning in through the car window or you saw Nurse Nancy actually opening the door for an adolescent to get closer to that arm. But we did it 5 or 6 and then all the way up to 18.
Perfect. And I think there was another question in the chat. They were asking if you use what report you used, and did you recall from Intergy? So Veronica, they are not on Intergy, they are on Centricity.
Yeah.
So they are a Centricity Health Center. They weren't using Intergy. We did
So
get another no, sorry, keep going.
Sorry, Florida shots too. So you can print Florida shots and have them give you a list of all your patients in a specific county, which we did. So we did a phone reach out to them as well. So we printed a list for Orange County, all of our Orange County patients that needed vaccines or were missing vaccines, which might come to Lake Underhill, that particular site. So they got a phone call or an automated phone call a week or 2 weeks before the event. And then some of those patients may have actually called to book in, and then our call center would book them.
I'm looking through the questions. It looks like you answered some of them already. They were asking about the age of the kids.
Mm-hmm.
So I think that's about it.
There is one more question from Ashley saying, was a well child done before they were able to get vaccinated, or did you have standing orders?
So we had standing orders for the vaccine, but they had to have had a well child within the year in order to get the vaccine.
Okay.
And then once again, remember, so let's say beyond the standing order, the MA would walk in and have the provider drop orders live on that morning, or actually throughout the day. We ran it from 8 a.m. to 6 p.m. And so at any time, the pediatrician that was actually working the event could have the opportunity to review the chart and say, something looks a little off for me, put them in a parking spot and let's convert them to a regular appointment and bring them in. We'll see them right now. And so that brings up another, which it may open up another Pandora's box of questions. So we normally have 2 pediatricians working at that location. We normally have, one pediatrician working at that location. We had 2 that day, and what we did was the regular pediatrician, we let them go ahead and see patients. The second pediatrician, we kept their schedule open, and they were just on call for this event. What we realized was the vast majority of our patients didn't need to see the pediatrician. The pediatrician was fine, go ahead with the vaccines, everything is good. And so what we're going to do for the November event is we'll still have 2 pediatricians, but we're going to double book them. And so we're going to make use of our time of the pediatrician that's normally there, they'll have a full schedule. We'll have an extra pediatrician in, they'll have a full schedule, and then their double book column will be all of the vaccines. And we may actually go to 3 columns on them, so they have 2 columns of vaccines, because as we saw, very few people needed to be converted to be brought inside.
Well, thank you so much. I don't see any other questions coming in the chat.
No worries. I'll be on for the entire call, so happy to come back on if you want me to.
Yes, and his section of the presentation, we actually separated it out into a PDF, so you can grab that from the attachments panel there and go to webinar if you're interested in that. And of course, we always send out the recording and all the meeting materials afterwards. Thank you so much, Nerez. Let me close this piece out. All right, so up next, we'll be hearing from Sue Ciatrigal, who's our manager of system optimization. She'll be talking to us today about some of the important updates on self-monitored blood pressure and UDS. Sue, are you with us?
I'm here. Can you hear me?
Yes, loud and clear.
Okay, great. Hi, everyone. I'm Sue Ciatrical, and as Stephanie had mentioned, I'm the manager of system optimization. And today I will be sharing information about the recent change to the hypertension quality measures related to self-measured blood pressure. So on this slide, it was recently announced by the measure steward NCQA, who clarified that the blood pressure reading performed on a remote monitoring device is acceptable to meet the numerator criteria for the hypertension measure. The blood pressure measurement device must be able to capture and store the blood pressure taken by the patient and be able to transmit directly to the EHR or a secure message. The blood pressure reading can be performed by the patient during the virtual visit as long as it is observed by the provider or the care team and is documented by the care team in the patient's chart. So here are just, some guidance, and this information was shared by HRSA. And there's other information that I'll be sharing later in the slide about guidance on what is allowed, and that information was shared by NAC as well as HRSA. So let's go to the next slide. So I just wanted to start us off. I'm sure the definition is known to everyone, but just in case, self-measured blood pressure refers to measurements that are taken by the patient in a non-clinical setting. Generally, it would be the patient's home. So knowing what this is and how to accurately or educate your patients to accurately take self-measured blood pressure is going to be very important, especially how this ties back to your quality measures. Let's go to the next slide. So ensuring accurate measured blood pressure reading is important. Not only is it important to help with the measure compliance, but also to help your patients obtain accurate results, which will then help them meet their blood pressure goals. So the blood pressure the home blood pressure measurement device your patient uses should be validated for clinical accuracy. Here's a link that I've provided, and this is also from the AMA. Excuse me. So the US blood pressure validated device listing provides a preliminary list of blood pressure measurements that are sold in the US that meet this criteria. So blood pressure measurement devices with an upper arm cuff will provide the most accurate measurement. And generally, many home devices come with cuffs that will fit the arm circumference for a small adult to a large adult. So using an inappropriate size cuff can lead to inaccurate blood pressure measurements. The AMA provides a 7-step self-measured blood pressure quick guide that has a link that you can share to your patients of how to measure for an appropriate cuff size. So providing your patients education on how to prepare and perform self-measured blood pressure ensures accurate measurements. Here is a link to a one-pager guide from the AMA of how to measure blood pressure at home. Let's go to the next slide. So here on this slide, guidance to what blood pressure readings are valid and not valid for numerator compliance. So on the list on the left is acceptable blood pressure readings acceptable blood pressure readings that are sent directly from the remote monitoring device to an app or secure. That's one example. Another example is where the patient would show the provider or sends a picture to the provider their blood pressure reading that is stored and dated in the memory of the device. And lastly, and which may be the most common scenario, is that the blood pressure reading is performed by the patient using the remote monitoring device and then is shown or observed by the provider or care team. So the list on the right are invalid blood pressure readings that would not meet the criteria for numerator compliance. These are examples of readings that could be altered by the patient. Unacceptable blood pressure readings are ones that are given verbally by the patient or shared via a text message that the patient wrote or perhaps sent in an email to the provider, or written on a paper log that is shown to the provider. A note here, and this is an exception specific for HEDIS, where they accept both digitally transmitted blood pressure readings as well as patient reported. So it's a little bit different for HEDIS than it is for UDS and for CQM. Go to the next slide. So here is additional guidance for UDS reporting on the hypertension measure. So here, only individual blood pressure readings should be reported, not the self-measured blood pressure averages. If multiple blood pressure readings are taken, use the lowest reading. And lastly, it's important to document, the self-measured blood pressure readings in a structured data fields that are used by your UDS or quality reporting. Okay, let's go to the next slide. And this is actually my last slide for this section. Steph, okay. So I think I mentioned this earlier. The AMA provided a webinar on October 6th about self-measured blood pressure and best practices and how the self-measured blood pressure can contribute or help with quality measures. So if you did miss this webinar, here's the QR code that you could that will link you to the recorded webinar.
Thank you, Sue. We're going to share the slides, so you'll get also the link if you can't use the QR code, but either way. We also have attached to the
Oh, wait,
handout
Steph, I'm sorry.
section. Oh,
Yes, thank you. I forgot to
there you go.
mention that earlier. Thank you for reminding me. There is a handout. It's called FAQ Recent Quality Measures Changes Related to SMBP. And the information that I had shared earlier during this presentation is listed out in this FAQ, and I hope that it will answer any of your questions that you may have. Again, it's just a collection of information that we've received from different sources. AMA includes information there, as well as from NAC and HRSA.
Thank you, Sue. Diana, do we have any questions in the chat?
You already answered them. Someone asked if we were going to make these slides available, which I replied to everyone. We will be emailing to them after the meeting.
Perfect, thank you. And I did unmute attendees. You can ask questions if you want. Otherwise, Sue is definitely on for the rest of the call. All right, thanks, Sue. I don't see anything else.
Great.
All right, so moving on, we are moving on to our updates from the CSO team. I don't know if you all knew this, but this month was actually National Cybersecurity Awareness Month. And in the spirit of preparedness, Michael Sangili, our network security engineer, will now talk to us about doing our part and being cybersecurity smart. Michael, are you with us?
Yep, I'm here.
Good, I can hear you.
Alrighty. So yes, thank you, Stephanie. It is National Cybersecurity Awareness Month. This year, the slogan is "Do your part, be cyber smart," and we break it down into 4 different weeks. There's week 1, which is this slide here. If you connect it, protect it. And essentially, what that's talking about is nowadays in 2020, we have 4.8 billion internet users around the globe. That is huge. That's 62% of the world. Now, that's just the users. That's not all the devices. When you add up all the devices that are connected, that number grows exponentially. I couldn't even give you a figure for that. And these numbers and these devices can range anything from your laptops to your desktops to your cell phones to now we have internet connected devices at home, such as everything from your thermostat to your lights to your refrigerator to even toilets nowadays are connected to the internet, weirdly enough, for some reason. But everything is connected to the internet nowadays. And what that leads to is the potential for more vulnerabilities in those devices and more chances for hackers to take advantage of those devices. That's why we always push the agenda of securing those devices, keeping them up to date, and protecting them in general, because it just leaves you exposed in far more different areas. So to give an example, last year, there was a DDoS attack, which a DDoS attack is essentially when a hacker takes advantage of tons of devices around the globe, they breach them, and they use the power of all those devices to attack one specific network, which will overload that one network because all these devices are attacking it, and then it brings down the network. That's a DDoS attack. So last year, they found a refrigerator that was sold all around the globe, thousands and thousands of refrigerators. They found that that specific refrigerator was not being updated by the company, and it had a very old, out-of-date system. So they took advantage of all these refrigerators. They hacked everyone's refrigerators. They used that power of all of those refrigerators around the world to attack one specific network and brought it down. Eventually, they discovered that the cause was a refrigerator. They couldn't discover what it was. They realized it wasn't some sort of computer like a laptop or something. It was a special, very simple device, and they discovered it was this refrigerator. So they patched it and resolved the issue. But that goes to show you, even these devices are susceptible to hacks and can be taken advantage of. 10 years ago, we would have never thought, it would have sounded like a joke if somebody says a refrigerator hacked my network. But now that's reality. So that's why week 1 is if you connect it, protect it. Any device you have connected to the internet, just make sure it's up to date. Now, week 2 is we can all help. It's no longer the job of just IT to protect us from hackers. This goes across everybody. So we have to be proactive, not reactive to these situations, because if you're reactive to this situation, it means you've already been breached. You're already scrambling to see what to do. I have a virus. What do I do now? Do I contact IT? IT starts panicking. What do they do? Because they're reacting to the situation. You have to react fast. So the best approach is to be proactive. Like I mentioned, and we mentioned again and again, keep your devices updated. That's being proactive. If those devices are updated, and let's say you receive a piece of malware and happen to get into your network, doesn't necessarily mean it's going to spread around your network or cause harm. The way malware works is it looks for out-of-date software or vulnerabilities to take advantage of and spread itself and cause harm. But if it's in your network and your devices are all patched and up to date, it may just not even be able to do anything. So that's why it's important to keep these devices up to date. Again, it's us to help IT. It's not just an IT thing anymore. It's important for us to, even if we see our system is saying you need an update to push out, usually IT will automatically push the updates themselves. But if we see on our computer saying you have an update, we don't just click skip. Don't just skip it. Notify your IT department. Maybe they don't know. Sometimes, you know, systems aren't perfect. They may miss that update. So if you see it, just notify your IT department, shoot them a quick email, open a ticket, whatever the process may be, and let them know, hey, my computer's telling me I need to update it. You don't want to be the cause of why malware or some sort of breach occurred when you trace it back and then you see, oh, it started at this PC that hadn't been updated in a very long time. So if you connect it, protect it, we can all help, and we can help IT. And the last thing is your internet connected devices in your network also need to be updated at home, as we spoke about. If you have lights or any kind of smart devices at home, open the apps. Sometimes they tell you there's an update. Nowadays, luckily, they're updating themselves automatically, but just open the app just in case. Sometimes they'll ask you to accept the update, and you want to accept it because that, again, that'll leave you vulnerable to some more attacks. Now, week 3, next slide, please. On week 3, they dedicated it specifically to healthcare, which is phenomenal. It's good and bad. The reason healthcare is such a big focus nowadays is because we are the #1 industry to be attacked by hackers. It used to be the finance industry because, you know, they used to do, like you see in the movies, that they wire transfer money and steal tons of money out of banks. Well, that's very rare nowadays. Financial sector obviously has the means to employ thousands and thousands of people to protect their networks, and it makes it very tough. Hackers learned that healthcare, especially smaller medical centers, don't have the means to that these giant financial sectors have to protect their networks. So they have been attacking healthcare networks. They know we have EPHI, which is very like I said here, a hacker's gold for them. So we have all these internet connected devices inside our health centers now. We have telemedicine, which has grown substantially ever since COVID. It's great for us. It's a push in the direction that is really effective for us. But at the same time, now it's opening us up to more vulnerabilities. There's digital health records, there's medical devices, there's patient wellness apps, and then there's all the different third-party apps that we use that are just little specialty apps. Well, all these things can have vulnerabilities in them if they're not taken care of properly. Now, as I spoke about EPHI, that's a hacker's gold. The hackers, they're trying to get into your network either to perform a ransomware attacks, like you may hear in the news, where they lock all your systems and your data and hold it ransom until you pay them. They don't release the information. Or they're looking for the hacker's gold, EPHI. They compromise the EPHI and then they list it and sell it on the dark web for money. And that's very unfortunate. What happens there is the privacy of the patients gets exposed. You run into all kind of HIPAA violations. You can get audited, and it just gives a bad reputation to your organization. So that's why we have to keep everything updated, keep everything secure. We have to always all work together to keep it in the back of our heads that this is a team effort, just not an IT effort. And we all have to just work together to protect PHI, which is, for cybersecurity, our #1 goal when it comes to the healthcare sector. And lastly, we have week 4. Go ahead to the next slide, please. The future of tech. So we have 4.8 billion internet users now. Imagine 10 years from now. 10 years from now, that number can grow. I mean, who knows what it's going to be. They're rolling out all kinds of new technologies to provide internet access to people in different areas that don't have internet access, like rural areas, you know, in the middle of a forest, or even on the countryside that you know, cable companies like AT&T or Comcast don't run cables out there, so they don't have a means of internet. So now we have satellites that are providing internet, and there's 5G connection, and there's all sorts of different ways for people to access the internet. Now, this is a great thing. We're going to give access to lots of people who don't have it. But again, this is going to open up more vulnerabilities to everybody. This means more connected devices, more chances for hackers to take advantage of, and also more health connected devices in the future. I mean, if we have all these connected devices now, imagine in healthcare, imagine what we'll have in the future. If you're ever interested, just Google the future of healthcare technology, and you'll see all kinds of interesting things that are being created nowadays connected to the internet. So that does lead us to more threats, unfortunately, and more security for all of us to think of in the back of our heads. So we just have to put together this effort. You know, the future is moving really fast. We have the more devices coming online, especially in healthcare. So it's just important for all of us to keep aware of this and perform our own personal risk assessments and security risk assessments on the devices we have. Go home, just check tonight, make sure everything's up to date. Open up your Windows or your Mac computer, click the check updates button, see if it's up to date. If you have smart lights, Philips Hue or Nest or any of those, open up the app, check to make sure they're updated. It's just protecting yourself. And if you have this in your own organization, which we see it all the time, we see a lot of people have the Nest thermostats in their organization. Make sure those are up to date as well. They are just as important as the computer, so just keep an eye on those as well. And on the last slide, speaking of security risk assessments, next slide, please. On the security risk assessments, for those of you in QTECH, which is everyone here, we've been performing our own educational series on how to conduct your own security risk assessments, which I know a lot of you have been attending, and if you haven't, we urge you to. It's not just an IT type webinar series. This can be applied to you at home. And you may be even part of your security risk assessment at your organization if you handle EPHI. So we just discussed on how to perform your own security risk assessments, which gives you a really good understanding from step one all the way to the last step on how to secure yourself, just in general, with security in general, from simple administrative tasks on how to handle EPHI properly to the more techie stuff on how to secure your firewalls and routers. So we just urge everybody to listen in on those sessions or educate yourself on the topic. Go on Google and research these different topics as part of Cybersecurity Awareness Month. I say use this time or use this month to just educate yourself on the topic. You can go online and type in Cybersecurity Tips 101, and there's a lot of things you'll learn on there that you'll be able to apply at home. So we just urge everybody for Cybersecurity Awareness Month just to keep educating yourself and keep learning how to protect yourself from all the different attacks that there are out there in the world. And that's it for me. Anybody have any questions?
Thank you, Michael. Also, folks, for sessions 1 and 2, we do share the recordings out to the QTECH members. So we'll be sending that in a follow-up email as well with our post communication after the call today. I don't think I see any questions on there, Michael. Do you see any, Diana?
Yes, I just saw one coming in from Marlene de Leon, who asks, quick reminder for those attesting for promoting interoperability, security risk assessments are needed.
Oh, thank you, Marlene, for that reminder. Yes, so security risk assessment is needed for promoting interoperability.
And yes, it's not only that we suggest it, but especially in healthcare, actually specifically, it's mandatory annually, and shouldn't even just be an annual thing for everybody to do. You should always keep up to date, maybe every month or every time you make a big change to your network or add some new software. Bring it up to your team. Let your IT departments know or your managers know that you're using a new software, and is this part of your security risk assessment? So definitely, thank you, Marlene. That is a mandatory thing.
Yes, thank you. And thank you, Michael.
Thank you.
All right. So moving on, Diabetes Awareness Month kicks off on November 1st. And with that in mind, Diana Chavez, our Diabetes Program Coordinator, will now talk to you all about the collaboration efforts with the University of Florida through Project ECHO. Diana, are you with us?
Yes, can you hear me?
Yes, I can.
All right, so many of you have already heard about ECHO, but let's start by giving a shout out for the Diabetes Awareness Month, which is this November. We are going to participate in this month's theme, which is actually Nurses Make a Difference. And in that effort, we are asking health center leadership to nominate a nurse. HCN wants to feature all nurses from our health centers throughout the month of November on our social media platforms. So if you're interested in nominating a nurse, we encourage you to look out for this communication that you see on the screen that we sent out yesterday, and we will continue to be sending it out so that you can access the link and nominate all of your nurses who are making a difference in the diabetes patient population. Next slide, please.
We'll share that again, just a quick plug. It came from communications at hcnetwork.org from our Chief Clinical Officer, Dr. Tim Long. If you can look for that communication, we do hope that we can feature your nurses.
All right, and with that, as I mentioned before, many of you are already aware of this initiative, but HCN has partnered with the University of Florida and Stanford University to participate in the Diabetes ECHO program to help community health centers improve health outcomes for patients with diabetes. This partnership with HCN is very important because ECHO is looking to empower primary care providers at FQHCs, which are known to provide care to underserved communities. Some of you have been part of the phase 1 of this research grant, but we are very excited about phase 2 because it includes the type 2 diabetes population that a lot of you have been requesting for. Next slide. All right. Sorry, that's my puppy. So our efforts are already on their way, and we began offering 10 spokes for our health centers here at HCN exclusively, but we have already filled 7 of those spots, and we only have 3 spots left. From those 10 spots, we're actually going to randomize them into 2 different cohorts, and this is a very important aspect of the step-wedge design of the research. Cohort 1 will kick off in February of next year, while Cohort 2 will wait for 6 months to kick off in August of next year. Next slide, please. So I wanted to give a brief overview of the benefits and commitments that if you do choose to participate in ECHO Diabetes. We wanted to highlight specifically that there is no cost associated with participating in this program, and in the contrary, every participating health center receives a stipend for each year you participate, in addition to the rest of these benefits you see on the screen. Health centers currently enrolled are also receiving additional grant money from grants that UF is constantly applying for. Not only do they get money and stipends, but they also get continuous glucose monitors and sensors for their diabetic patients. As you can see on the screen, health centers that participate in the weekly clinics with UF receive continued education credits, as well as resources from both Stanford and UF University at the University of Florida. And also, which is actually a very important aspect of ECHO, you're going to get access to the diabetes support coaches, which provide that social support that is very important for the care and management of diabetes patients. From your commitments, you will have to attend those weekly clinics with UF, but you can also assign a team to remove some of that burden from providers. When it comes to data reporting, HCN will help you gather that data and report it to UF, and the coaches will also remove some of that burden when collecting data from the patient. Next slide, please. So if you're interested in hearing more and have specific questions that pertain to your health center, we encourage you to schedule a lunch and learn session as soon as possible. Lunch is provided by UF and will be delivered to your health center while you listen to a virtual session with the UF team who is going to address all of your questions. Recruitment of health centers ends in October 31st because there is a lot of onboarding procedures that need to take place. So if you are interested in taking up those 3 last spots in this program, please email me as soon as possible so I can contact the UF team and get you in our schedule as soon as possible. And now I actually want to open it up because I do see 3 of our health centers who are currently participating in the Diabetes Echo program. And I wanted to ask one question to those health centers. What do you think has been the most beneficial aspect of participating in the Echo program? Either somebody from Community Health Centers of Pinellas or Miami Beach Community Health Centers or Jesse Trice Community Health Centers.
I have gone ahead and unmuted attendees. If you do want to speak up and you are from one of those health centers.
No, everybody's feeling shy. Well, from sitting in some of these lunch and learn sessions, I can tell you the 7 health centers that we have enrolled so far are extremely excited. They cannot believe that you get so many benefits for no cost and for such limited amounts of requirements. And we look forward to hearing from you. If you are just shy and don't want to speak up right now, you can put it in the chat if you have any questions, or you can always email me. My email is always available for any questions. So next, I wanted to talk about another initiative we're currently developing, as Steph mentioned briefly. It is the celebration of World Diabetes Day. For those who don't know, World Diabetes Day was established in 1991 by the International Diabetes Federation and the World Health Organization. The theme for this year, as I mentioned before, is Nurses Make the Difference, and the date is November 14th. The symbol is that blue circle you see on your screen. So this year, Health Choice Network will dedicate the entire month of November to raise awareness and provide educational tools to our health centers via email, social media platforms, and quality initiative forums, such as this one. So again, this is the QR code to scan if you do want to nominate those nurses to be featured in our social media outlets. And lastly, I wanted to talk about this other initiative, which is actually developed by the American Diabetes Association. This usually takes place in person. These are summer camps dedicated for pediatric patients with diabetes. And we encourage you to share this with all of your patients. It is a very engaging online opportunity now because of COVID, and it is free of charge. The first session is already on the way, but the second session begins November 3rd through the 21st. And for everything that I hear, it engages the entire family so that pediatric patients can feel more of that social support that they need to be more successful in managing their disease. And with that, I will pass it on to Steph.
Thank you, Diana. We did get a question in the chat. Andrea was asking, can we nominate more than one nurse? Do they have to be an RN, or can they be an LPN as well?
They can be an RN or an LPN, and we actually encourage you to nominate as many nurses as you think that make a difference in your patients. Absolutely.
And Andrea, also, once you nominate them, we will reach out to them, and of course we'll reach out to the health center, make sure it's okay, because we do want to share their story on our social media. So it is going to be part of a Diabetes Awareness Month campaigning. So more to come, but do look out for the email. It came from HCN Communications, sent by Dr. Tim Long. I don't see anything else on the chat, Diana. So thank you. All right, so I'm going to give some QTECH grant updates from myself, yours truly. So just bear with me. I do want to talk a little bit about class again. I know you all have heard about it. It was born from our efforts here for QTECH because one of our goals was to ease provider burden. So we joined the Class Art Collaborative, and one of the grant goals for our current 3-year cycle is to enhance the patient and provider experience. We have worked with class on this survey, and it's currently ongoing. For those of you who log into Citrix and we host your EMR, you probably did see the banner come up every day when you logged in. We encourage, if you haven't done so, please take the survey. I don't need to go through all the slides, but I did put this on the deck. You know, some of the things we're trying to do is to assess how folks feel about the EMR and their experience. The data is going to give us an opportunity to analyze opportunities for assessing workflows, assisting and easing burden, seeing what other things can be done with the EMR to help out care teams. So it's definitely something that we really hope that you all can participate in. And through the EMR survey, we're going to try to answer some important questions like, so how satisfied is the staff with the EMR? So getting a better understanding of staff's concerns. It could help us inform how the EMR experience has been improved. Can be improved at the health center. It's going to survey multiple EMRs. This is inclusive of the dental, behavioral health EMRs, not just Athena or Centricity or Energy. It's going to be all types of EMRs. And why does this matter, right? So, we all hear about provider burden. We want to bring back the joy in practice, and we know that provider burnout is associated with making more mistakes, scoring lower on scales of measuring empathy, reduce patient satisfaction, and reduce patient adherence to treatment plans. So ultimately, we want happier providers, happier care teams for better patient outcomes. Class works with organizations from around the country, and they help others understand the EMR. And what's unique about the situation that we have now is that for the most part, they have experience with working with hospital systems and academic institutions. But this is one of the first times that we're getting multiple networks together and all their health centers to respond to the EMR to help us use actionable data so that our voices can be heard in terms of what's being done with the EMR. The image you actually see here is from their data, and this is for one particular EMR. And the satisfaction or the dissatisfaction is on the same EMR. So the feelings around the EMR isn't just the functionality of the EMR, rather the factors that affect how they use the EMR. Class developed a framework of a successful framework for better understanding and guiding organizations on their journey to improve utilization and satisfaction with the EMR. There's 3 traits to this formula. First is that the users feel that the EMR meets their unique needs for which they use the EMR to do their work. And that's whether they do primary care or behavioral health or working with targeted patient populations. Next is a strong mastery of the EMR, that they truly believe that they know how to use the EMR to capture and effectively report valuable information for patient care in the EMR. And lastly is shared ownership, that the user feels that they have a voice in influencing the shape and the evolution of the EMR and how the health center uses it. For example, those who sit in optimization work groups or who help to develop and pilot new forms in the EMR and work with vendors and their health center to change the EMR tend to be more satisfied with the EMR. So that was pretty high level, and I know I've said it before, but I did want to push it. It's a great impact that we have right now. So we're talking about 148 health centers across 33 states. We've got over 20 EHRs being represented. So that's over 4,000 providers that we can potentially tap into. And this is inclusive of everyone. This isn't just your primary care provider or anything like that. We're encouraging nurses, LPNs, pharmacy, clinical licensed social workers, anybody who affects patient care and is working with the EMR can respond to our survey. We're working in conjunction with Alliance Chicago, Breakwater Health Network, CHAN, Hawaii Primary Care Association, INCC or In Concert Care, and the Vermont Rural Health Alliance. And I'll end there with that. This is the class survey. That QR code, you can put your phone up to the screen and take the survey if you haven't already done so. Originally, we were closing it out on the 23rd, but we did manage to get it extended through the 30th. So please, please, please share. Health centers who do participate will receive a report for their health center leadership that will explain the results of the report. It is an anonymous survey, so we can't see who answered what, but it will let them know how the health center feels about the EMR usage. So on to the next thing. I did want to talk a little bit about QTECH. So we all meet monthly for QTECH and QTECH Monthly Committee, and I did want to bring up this slide just to remind us of why we meet. We've got 30 health centers that sit on this call, and we appreciate you all very much. Um, our 3-year grant period for this cycle will end on July 30th of 2022. We've got 3 goals and 9 core objectives. Those are listed here on the screen. The provider burden piece on the first section for enhancing the patient and provider experience, that's part of our class effort. We do have some work going on also for patient access and patient engagement, which I'll show in some slides coming up. And then of course we've got advancing interoperability and using data to enhance value. Another one that we did take through HRSA for our grant, which was applicant's choice, we did pick telehealth. So I just wanted to highlight some of the items that we have worked on over the last year. On the left side, we do have our goals and objectives, but some of the things we have done is we have our high-tech partnership going on. We've got some webinars, which I'll talk about in a bit, that are coming out. We have had Jillian Massini present in our QTECH committee as well. We have helped our health centers, certain health centers, not all, but those who have requested help from our strategic partner services team with patient portal, engagement onboarding applications such as Phreesia, Cure for You, and Solution Reach. We do feature our health center spotlight, which does help us highlight those promising practices, just like Nerez did today, and we hope that other health centers enjoy that and that we can continue providing that every month. And of course, our survey, which I just talked about through Class Art Collaborative. For our section B, which is around data, we do have our CISO team we highlight every month. They do have the 6-part webinar series that's coming out that's educating everyone on how to do the SRAs. That is for anyone. It doesn't matter what EMR we're on. Those are offered for our QTECH folks. And of course, we will send the flyer and information for that. And we've also helped our health centers with Dentrix interoperability into Energy. We've provided some prepare education at the start of the grant to help tie back to these goals. And then lastly, for goal C, one of the biggest things, and obviously because of the pandemic and COVID, really pushed our telehealth much quicker than we anticipated. All the health centers did have to get onto telehealth, so we did provide user guides and we did have our COVID webinar series. And we're currently working on Health Catalyst, which is one of our biggest projects where no matter what EMR you're on, you'll be able to hook up to it once we're live, and we'll be able to get great data out of that data lake and pool. And that will be something that we'll talk more about once we're ready to launch. We're currently in the development stages of that. And I say all of this because annually we do our health center individual work plan reviews. Last year, as you all recall, we did have a one-on-one touch point with all you folks on the call. We're at that time again, so I've taken out my handy dandy thermometer where I'll show you all where we're at, but I do need to touch all the health centers, all 30 health centers at some point. You're going to be hearing from myself, the quality initiatives team, the quality outcomes team. We're going to try to merge our meetings together so that we can get some progress on your work plans. And we really appreciate the time that you all take. We know that these do take some time, but be on the lookout for that. We're going to be sending that out in the coming month. And also, after today's call, I'm going to be e-blasting out this QTECH questionnaire to you and all the health center leadership. This form will take some time to fill out and may require the assistance of multiple team members. So one of the things we learned from last year when you all filled it out was that you all wanted a PDF. There is a PDF version attached to the handout section of this webinar. When you go into it, if you scan it now in the primary part of the overview of the survey, you can also click the link and download a PDF version. You're going to want that handy as you begin to fill out your responses, because it will take some time, and it does cover the breadth of the entire grant and all the questions that HRSA asks of us. So it will take some time, but we do ask you that you do fill it out. The goal is to have this questionnaire filled out prior to the one-on-one work plan meetings that we're going to be scheduling, so that it can help us focus and hone in more on where your individual health center is at. And again, we appreciate you all taking the time to meet with us and fill out the form. And as we begin to wrap,
there is a question.
Yes.
About class, I'm thinking. Dr. Andrea Brooks wants to know, has any other formal communication about the extension to October 30th been sent out?
No. So, Andrea, you're right. Some communications did go out from Dr. Long originally. You did get some from Meredith Marsh, our Quality Improvement Officer, and we had our CEO and COO did send out some communications to the C-suite at the beginning, and then of course there was the Citrix login, and then we've done some e-blasts as well. I actually just updated this because I got the news not too long ago. So that's why I just kind of put on the slide that it's been extended, but I do plan on sending out a communication to encourage health centers to continue filling it out. So yes, that was kind of hot off the presses from this week. And I do plan on sending out a communication to let everybody know that we do have some time to fill this out, and it doesn't necessarily close out this Friday, but next Friday. Is that it, Diane, on that end? Yeah, I think so.
Yes,
Okay.
that's all.
All right, good. And then, of course, this is our joint Alliance Chicago and Health Choice Network virtual conference. We really do wish that we could be together, but we are together virtually, and we are better together as two networks. So we do encourage you to sign up. It is free. It's gonna run from November 4th through the 12th. If you have not registered, please register. We highly encourage you to. We have great speakers coming up. And as always, normally we do a QTECH track for the annual conference that we do face-to-face in Boca, but since we're not together and we still are virtual, we still went ahead and made a QTECH track for you all to attend. Of course, you can attend any session you want, but this is in the panel section of the webinar. You can download it. The PDF version, it gives you the programming that we suggest that is more linked to the grant and to our HRSA grant goals and deliverables. And on the last page of that PDF, you're going to find recommended programming that is EMR specific. And we have tracks for both Entergy and Athena this year. So if you're interested in Athena stuff, there's also stuff there that you can see on the third page of that PDF. And then for our upcoming, we've got some high-tech webinars. HCN has partnered with high-tech, and we have a two-part webinar section coming up now on understanding PA version 12 and UDS 2020 reporting for Greenway Entergy users. Health Choice Network will be highlighting the UDS measures most impacted by the upgrade to Practice Analytics version 12, how Greenway 2020 UDS Forum attempts to help centers meet those new PA standards, and insights on how HCN has made changes to ensure our customers are set up for success. These are, we really hope you can attend. Our very own system optimization team will be presenting on these, and we'll send you the link. You can scan it through here, but this is a partnership with Health Choice Network and High Tech. And of course, in December, we've got our HIV month, and to kick it off, we do have our very own care resource presenting. Dr. Steven Santiago, their Chief Medical Officer, along with his HIV team, will be presenting. We highly encourage you all to attend this. We're very excited about this webinar. And that's really it for me. I believe I'm giving you back about 15 minutes of your day. We do appreciate you for logging on. Our next meeting is scheduled for December 3rd. Please don't forget that we normally combine our November and December meeting because of the holidays. You know, we do it at the end of the month, so it falls right on Thanksgiving. And I know we're not all logging in on Thanksgiving, so we're combining November and December. I will be pushing out a cancellation for our November meeting and re-pushing out a new invite for December 3rd, which will cover both months. We do hope that you all have a fabulous afternoon and a wonderful fall season. Look out for our email, and thank you very much, everybody, for logging on, and thank you to our speakers and Nurez. Bye, all.